Hey, it's Dr. Toker, and welcome to Tushie Tuesday, the day of the week where we seem to talk a lot about people's cheeky buns. This week, we're going to discuss what is an anal fissure. Because a lot of people actually ask me that. They don't know the difference between a fissure and a hemorrhoid, and so we're just going to discuss what the difference is, what the treatments are, and God forbid you need surgery, what the surgery involves. So most people will come to me thinking they have a hemorrhoid just because their butt hurts. So not all anal pain is the same, my friend. If you've got pain, especially when you use the restroom, especially if it feels like this ripping, tearing pain, then you just might have a fissure. Fissures are caused actually by an increase in muscle tone, typically, and typically lead to what's considered an ischemic or low blood flow ulceration. And that ulceration can be deep and expose the muscle layers of the anal canal. In fact, so deep that that little pocket that forms can get infected. And so a fissure can be a really pain in the arse, if you know what I'm saying. There are a couple of medical managements to anal fissure. One of them is a smooth muscle relaxant called nitroglycerin. Nitroglycerin can cause a headache, so some doctors will write for nifedipine, also a smooth muscle relaxant. It's not as effective as nitroglycerin, but no headache. We also suggest for those patients avoid diarrhea, avoid constipation. Those are the reasons you got the fissure in the first place. Take warm baths. Again, muscle relaxation. That advice helps probably 60 to 70% of the time. And if it doesn't help, then it's, unfortunately, a trip to the operating room. The procedure we typically will perform is either a chemical sphincterotomy where we inject Botox. I know, it's not for beauty. We don't want you posing for any, unique magazines or anything like that. It goes in the internal sphincter muscle to relax it. But the classic surgery is called a lateral internal sphincterotomy, where we actually cut part of this muscle, and we do so to decrease its muscle tone. Now, everyone calm down. While the complications of doing that could be you cut too much muscle, typically people who have this condition have too much muscle. And so making a small relaxation incision in that muscle decreases the muscle tension, increases the blood flow, allows that ulceration to heal. If your doctor thinks you do not have enough muscle, he's not going to cut it. He's going to do the Botox thing. All right, so that's kind of how we decide how we do that. And I'll see you next week.